If you're over 60 and you feel that familiar crackle in your knees when you get up, or a deep, dull ache in your hips after a short walk around the block, listen carefully. These aren't just the normal wear and tear of life. They're warning signals from your body, whispering that something critical may be missing. I'm Dr. Michael Grant. For over 3 decades, I've dedicated my life to understanding the intricate dance between nutrition, aging, and health. I've sat with countless patients, listened to their stories of pain, loss of mobility, and the quiet fear that aging often brings. And I've witnessed firsthand how lives can be transformed, not by high-tech surgeries or endless prescriptions, but by the simple, powerful act of giving the body what it truly needs. Today I want to open a door for you, a door to stronger bones, smoother joints, and a life where each step feels lighter, more confident. I'm going to walk you through 3 essential vitamins, 3 nutrients that act like architects and engineers for your skeletal system, helping to rebuild what time has worn down. And trust me, you'll want to stay with me until the end, because I'll be sharing a little-known medical insight that many doctors overlook. It could mean the difference between living your later years with freedom or facing serious, irreversible joint surgery. If you care about staying active, independent, and vibrant well into your 70s, 80s, even 90s, then this next few minutes could be the most important investment you make today. Let's get started. Now, let's start with one of the most critical vitamins for your bones, vitamin D, often called the key that unlocks calcium. You see, vitamin D isn't just about getting a little sunshine, it's the gatekeeper for your bones. Without enough vitamin D, it doesn't matter how much calcium you consume. Your body simply can't absorb it properly. Imagine pouring cement without water. It stays dry, useless. That's what happens when your body lacks vitamin D. Calcium remains ineffective, and your bones weaken silently. What does vitamin D do exactly? First, it dramatically boosts your body's ability to absorb calcium, the main mineral building strong bones. Second, it plays a crucial role in reducing the risk of osteoporosis, a disease that turns your bones fragile, like thin glass. Third, vitamin D strengthens your immune system, something many older adults underestimate. Good immunity isn't just about fighting colds, it's about keeping inflammation and joint pain in check too. Let me tell you a real story. Mary, one of my patients, was 72 years old when she came to see me. She had persistent back pain and complained of feeling tired all the time. Mary, understandably, avoided going outside because she had a history of skin cancer. But that meant she wasn't getting enough sun exposure. When we checked her blood work, her vitamin D levels were shockingly low. We started her on a modest daily dose, 1,000 IU of vitamin D3, with her oncologist's approval. 4 months later, Mary was a different person. Her bone density had slightly improved on her scans, her back pain lessened, and her energy. She said, and I quote, "I feel 10 years younger. That's the quiet power of vitamin D." So, what's the takeaway here? If you're over 60, spend most of your time indoors or live in areas with long winters or cloudy skies. Checking your vitamin D levels isn't optional. It's essential. It's one simple blood test that can protect you from fractures, hospitalizations, and years of reduced mobility. Now, where can you get your vitamin D? Food-wise, some of the best sources include fatty fish like salmon, packed with vitamin D and heart-healthy fats, egg yolks, nature's little vitamin capsules, fortified milk and dairy products. Check the label to make sure they're enriched. Still, even with a good diet, many older adults need supplements to maintain healthy levels. When choosing supplements, go for vitamin D3, not D2. D3 is better absorbed by your body. For most older adults, a daily dose of 800 to 2,000 IU is safe and effective. But always check with your doctor first, especially if you have other medical conditions. Friends, bones are living tissue. They respond to care and attention, even at 60, 70, 80 years old. Give them the nutrients they need, and they'll carry you with strength for decades to come. Now, we've talked about getting calcium into your body. But have you ever wondered, how does calcium know where to go? Most people assume, I take calcium, it goes to my bones, right? Unfortunately, it's not that simple. Without the right guidance, calcium can settle in all the wrong places, like your arteries, leading to dangerous health issues. That's where vitamin K2 becomes a game changer. Think of K2 as the traffic cop for calcium. It directs calcium straight into your bones and teeth, and it tells it to stay away from your arteries, your heart valves, and your soft tissues. What does vitamin K2 do exactly? First, it ensures that calcium locks into the bone matrix, making your bones stronger and denser. Second, it works hand in hand with vitamin D. While vitamin D helps you absorb calcium into the blood, vitamin K2 ensures it gets delivered exactly where it's needed, and nowhere else. Third, emerging research shows K2 may even reduce arterial stiffness, keeping your blood vessels more elastic and your heart healthier. Let me share a real story. Harold, a patient of mine, 68 years old, had been diligently taking calcium supplements for over 5 years. He believed he was doing everything right. Yet when we checked his bone scans, there was minimal improvement. Worse, a cardiac scan showed early signs of calcification in his arteries. It was a wake-up call. We added vitamin K2 to his routine, specifically the MK7 form, which stays in the body longer and works more effectively. We also adjusted his diet to include more natural K2 foods. 6 months later, his calcium score had stabilized, meaning no new hardening in his arteries. Even better, Harold told me, "Doc, I can walk upstairs again without my knees complaining." Small change, massive difference. So what's the big lesson here? Taking vitamin D without K2 is like pouring concrete without using a mold. The cement spreads everywhere, even places you definitely don't want it. But with vitamin K2, you shape the calcium precisely into your bones, keeping your arteries clean and your mobility intact. Where can you get your vitamin K2? The richest natural source is natto, fermented soybeans popular in Japan. Now, I'll be honest, natto has a strong smell and a sticky texture. Not everyone loves it. Other good sources include aged cheeses like Gouda and Brie, delicious and packed with K2. Egg yolks, another reason not to skip the yolk if your doctor allows it. Supplements are also a smart option, especially MK7 form of K2. For most older adults, a daily dose between 90 to 200 micrograms, mcg, is both safe and effective. Again, always check with your healthcare provider before starting any new supplement, especially if you're on blood thinners. Friends, remember, healthy bones aren't just about adding calcium. It's about directing it wisely. Vitamin K2 is the compass your bones have been waiting for. When most people hear vitamin C, they think of colds, flu, or maybe a glass of orange juice. But what if I told you that vitamin C is actually one of the most powerful and most overlooked defenders of your joints, especially as you age? You see, vitamin C is your body's master tool for making collagen. Collagen is like the soft padding in a shoe. It cushions your joints, absorbs shock, and helps you move smoothly. Without enough collagen, joints get stiff, cartilage wears down, and pain begins to creep in. Key functions of vitamin C: stimulates collagen production. It's the key ingredient your body needs to rebuild and maintain healthy joint tissue. Reduces oxidative stress in joints. By acting as a strong antioxidant, vitamin C helps neutralize damaging molecules that speed up joint aging. Helps regenerate cartilage. Especially important for seniors, vitamin C supports the slow repair and rebuilding of worn cartilage. Let me share the story of Linda, a lively 75-year-old grandmother. She loved gardening, walking with friends, and keeping up with her energetic grandkids. But gradually, knee pain crept in. It got so bad she had to miss family hikes, something she loved deeply. When Linda came to see me, her diet was low in fruits and vegetables, the prime sources of vitamin C. Together, we started simple changes. She began taking 500 milligrams of vitamin C daily, a gentle buffered form to avoid stomach upset. She added more citrus fruits, colorful bell peppers, and a handful of strawberries to her daily meals. We also encouraged her to take short, gentle walks, just 10 minutes a day at first. 6 months later, Linda wasn't just walking again. She went on a cruise. She climbed up and down boat decks, explored new places, and lived with joy. Her secret weapon? Collagen, built naturally with vitamin C. You can't rebuild a house without bricks. And for aging joints, collagen is the brick, and vitamin C is the tool that helps you make it. Never underestimate this simple vitamin. It's not just about preventing colds, it's about keeping you moving, active, and independent as you age. Best sources of vitamin C: fruits, strawberries, kiwi, guava, vegetables, bell peppers, broccoli, Brussels sprouts. Supplements: 500 to 1,000 milligrams per day, especially helpful if you have a sensitive stomach. Look for a buffered form. Remember, real food first, supplements second. A colorful plate means healthy joints for life. Before we wrap up today, I want to give you a bonus tip that many people, and even some doctors, often overlook. Strong bones and flexible joints need more than just vitamin D, K2, and C. Behind the scenes, there's a support crew working quietly. Magnesium and omega-3 fatty acids. 1. Magnesium, the activator. Magnesium plays a critical role in activating vitamin D. Without enough magnesium, vitamin D can't properly help your body absorb calcium, no matter how much sunlight or supplements you get. Sadly, many older adults are low in magnesium because our diets often lack enough leafy greens, nuts, and seeds. Best food sources: spinach, Swiss chard, almonds, pumpkin seeds. Supplement dosage: around 250 to 400 milligrams per day, preferably in forms like magnesium glycinate or citrate for better absorption. 2. Omega-3 fatty acids, the inflammation fighters. Omega-3s act like natural anti-inflammatories for your joints. They help reduce swelling, stiffness, and slow down joint damage over time. Best food sources: fatty fish like salmon, sardines, and mackerel. For vegetarians, flaxseed and chia seeds offer plant-based omega-3s. Supplement dosage: aim for about 1,000 milligrams combined EPA and DHA daily. Think of your bone and joint health as a symphony orchestra. The vitamins are the instruments, powerful and vital, but magnesium and omega-3s are the conductors behind the scenes, making sure every note hits perfectly. Support your bones fully, not just with vitamins, but with their backstage heroes too. You don't have to feel stiff, tired, or fragile just because of age. These 3 vitamins, vitamin D, K2, and C, can be your first line of defense for stronger bones and smoother joints. I've seen firsthand, after decades of practice, that aging doesn't have to mean a slow decline into pain and limitation. We've all heard stories of older adults who seem to age faster than others, whose joints creak and whose bones seem fragile. But the truth is, those symptoms aren't just a natural consequence of aging. They're often signs that our bodies are lacking key nutrients. Let me share with you the stories of 3 patients: Mary, Harold, and Linda. They didn't take shortcuts. They didn't rely on fancy medications or invasive surgeries. Instead, they added the right nutrients to their diet and gave their bodies exactly what they were quietly asking for. Mary was 72, struggling with back pain and fatigue because she wasn't getting enough vitamin D. After a simple change in her diet and a daily supplement, her energy returned. Her bones strengthened. She felt like she had reclaimed her youth. Harold, at 68, had been taking calcium supplements for years, but his bones weren't improving. Once we introduced vitamin K2 to direct calcium to his bones and away from his arteries, he felt stronger. His bone density stabilized and his knees no longer hurt when climbing stairs. And then there's Linda, 75. She was an active grandma, but her knee pain kept her from enjoying her life. Her diet was lacking in vitamin C, the key to rebuilding collagen. After adding vitamin C, she regained mobility and even went on a cruise with her family. So, if you're feeling sluggish or stiff, take a closer look at your diet. Talk to your doctor about the vitamins you might need. It's never too late to make small changes that can have a huge impact on your health. Remember, aging is natural, but suffering doesn't have to be. Our bodies are incredibly resilient. With the right support, they can continue to serve us well for years to come. If this video helped you or someone you care about, hit like, subscribe, and share it with someone over 60. Let's spread the knowledge and help others age gracefully. See you in the next video.